At ECS, we try and ask ourselves the question, if homelessness happened to you, what would you want it to look like? What would you want the system to look like? What would you want the shelter to look like? What would you want the housing to look like? ECS really needs to start every day looking through that lens, if homelessness happened to you.
Coordinated entry, right, is a widespread systems transformation which says that supportive housing is a limited resource and ought to go to people who need supportive housing most. We assessed 4,000 people, homeless people, so ECS and the City and County of San Francisco know more about the homeless population than we ever have in the history of our work with homelessness. Now, when we assess someone on the corner of 10th and Howard, we can let them know immediately whether they've been prioritized for housing and take them to our Housing Navigation and Stabilization Center. So the first function is assessment. The second is, I'll combine it, navigation and stabilization. We navigate people to housing, which is getting them document ready, and then once they've been placed in housing, we work with them for up to 2 years to keep them in that housing. And then the third component, in effect, of adult coordinated entry is we do problem solving, which puts homeless people at the center of their solution.
Our ECS shelters play a major role in the city, and especially for the homeless population. You know, there's a lot of homeless people out there that need a place to sleep and lay their head, and also receive a meal, and have a place to shower, and have a place to be connected to support services. ECS opened the first navigation center in the country in March 2015. What's unique about the navigation center is that when a guest enters, you really don't know who the person is. The first 30 days is like a respite. The person comes in tired, they come hungry. The basic life skills, they have forgotten. 60, 90 days later when they're housed, all of it is automatic. You know, they have a voice, they know how to speak up for themselves.
The population over 50 years old continues to grow across the country for those housed, but in particular for those unhoused. And at ECS, we're trying to position ourselves and make adaptations within the organization to be able to meet the needs of that unique population.
The workforce development programs offered at ECS are designed to empower people, to put some of those choices for your future in your hands. I had 3 job offers a month before my graduation. Solid job offers, full-time with benefits. I accepted one with Wolfgang Puck Catering. I am certain that the Chef's program made my period of homelessness a one-time, never to be repeated, terrible thing in my life. I've been able to stand on my own 2 feet, have my own apartment, I pay my own rent, my own bills. I've got a good life.
ECS, with our partners, is currently developing the largest supportive housing site in the City and County of San Francisco, located on 7th and Mission Street. That building will house over 250 of the most vulnerable, highest need, chronically homeless in the city of San Francisco. In that building will also be housing the Tom Waddell Public Health Clinic, which will be providing urgent care. Homelessness is one of the most significant issues that we're facing in this community. We really have got to leverage the full capacity of this entire community if we're going to end homelessness in San Francisco.